How do you prepare for the birth of your baby? Well, during the coronavirus pandemic, preparing pretty much the same way that you would anyway. But you may need to take a few extra precautions. And that's particularly the case if you're planning a home birth. You will definitely need to check with your midwife. Unfortunately, some maternity units have stopped home births because of shortages of midwives. You may also need to get prepared a little bit further in advance than you normally would. And that's because, of course, it's not as easy to pop out to the shops and get everything that you thought you might need. You do need to get your labour bag ready, just as you would have done anyway, and I can personally tell you how important it is not to leave that too late. During my first pregnancy, I was a bit superstitious and ended up having broken my waters crawling around in my loft space trying to find a bag. So you'll want to have the number of the labour ward ready, and of course it's very important if you're self-isolating because somebody in your family has symptoms of possible coronavirus, or of course if you have possible symptoms, that you let your maternity unit know. If you do have symptoms when you go into labour, it's very important to let your maternity know immediately that you have symptoms. They'll advise you to go by private transport if you can, or to ring 111 or 999. And you will need to go into an obstetric unit so your baby can be closely monitored. When you arrive, you'll be met by a team with a mask so that you can be taken to an isolation ward, and you will usually be tested for coronavirus. Now, the good news is that the majority of women who go into labour when they are potentially or are coronavirus positive can still have a vaginal delivery, and it is still possible to have gas and air and to have an epidural or a spinal. A small number of women will need to have a caesarean, but it shouldn't be significantly increased. You will, however, need more careful monitoring. It's important to remember that, of course, while most hospitals will allow one birth partner in with you for labour and delivery, there may be restrictions after you've had your baby. And if your partner has symptoms of coronavirus, clearly they won't be able to attend with you. What will happen if you have symptoms will depend on the hospital's policy.